just have a slight delay here. So again, welcome back. Welcome back. We're doing the diabetes Q&A this evening. Thank you so much for joining me. I'm so happy to have you guys on here. Welcome to everyone on Facebook Live and here on YouTube Live. So generally, when I do these Q&As, I always like to start with a review of what we've been talking about, and it looks like I just want to be sure that my video is coming up. Just give me a second here. But generally, I do a review of what we've been discussing, and so I want to go ahead and review some things for you guys. So what we spoke about before was um sorry, I spoke about risk factors for diabetes and then some of the signs and symptoms. And then we talked about some things that you can do either before you need to take medications, so to prevent you from getting there, or if you're already on medications, to use it as an adjunct. So I am going to go ahead and let me see, make sure here for all of you who are joining me. Thank you again for joining me. I just want to make sure that you can see the video. Okay. So, all right, let's get into everything. So basically, the risk factors that I thought talked about before included being overweight or obese. So basically that means a BMI greater than 25. That is the strongest risk factor for developing either pre-diabetes, which is basically what happens before you reach diabetes, and then diabetes. And oftentimes, what I tell my patients is this: if you have hit the numbers where you're in pre-diabetes, that should be an indication to you that you need to make some changes, some lifestyle changes. And we'll talk about those in a little bit, but make those lifestyle changes so that you don't get to the point of having diabetes. Because oftentimes what happens is if you become diabetic, there are some what we call microvascular changes that are not reversible. And so you just don't want to cross over into that area. That's if you have not developed diabetes yet. If you have, now you can absolutely work on decreasing your weight in order to improve outcomes. So, some of the other risk factors that I talked about were family history, older age. So, the older you get, the higher your risk. Having a poor or high sugar, high carb diet, and if you don't know what I mean by that, is eating a lot of sweets or eating a lot of things that can be potentially be harmful. Um, or it may not feel harmful in the moment. You may be enjoying it, enjoying your sugars, but and carbs like breads and rice, and starches, but eating too many of those things without having any kind of um, balanced diet. That's the best way to put it, having balance. So eating too many of those things basically can ultimately lead to diabetes. Another thing is having what we call a sedentary lifestyle. So just sitting, not really what we call couch potatoes. You know, it may not be necessarily a couch potato anymore, but wherever you're choosing to sit at. So generally, I think that those areas are the ones that we need to kind of target, making sure that our diet is improved and making sure that our lifestyle is not sedentary. So get out, get active, even if it's just walking around the block a few times, or walking in your neighborhood. Those things can absolutely help. So the other things that increases your risk are having gestational diabetes, and that basically means having diabetes or having glucose intolerance while you are pregnant. So if you ever were told that, or if you ever had that, that does increase your risk of developing diabetes later on in life. Also, a history of polycystic ovary syndrome. Oftentimes, that's also associated with the one I spoke about before, which is BMI. Because if your weight is elevated, then that is, like I said before, the highest risk factor. Now, one of the guidelines that we have, and I mentioned it in the videos before, was that the US Preventative Services Task Force gave the guideline that they recommend screening for prediabetes and type 2 diabetes in anyone, any non pregnant adult who is 35 to 70 years old. And we only exclude the pregnant patients because in pregnancy you will get screened anyway. But 35 to 70 years old for anyone who is overweight or obese. Again, BMI greater than 25. If you do not have symptoms of diabetes, if you have symptoms, that you fall into another category and you're going to get tested anyway. So that's generally how we think about, the process of how we determine testing. So I spoke about things that are modifiable risk factors, so meaning things that you can do something about, and non-modifiable risk factors. So the modifiables are the things like the diet and exercise, how much alcohol you're drinking, things like that. The non-modifiables are your age. Obviously, we all wish we can turn back the ends of time and be a little younger, but that's not something that's possible. So, your age, your race, or your ethnic group, and then family history. Those are things that unfortunately we can't change. So, we can take those into account and make sure that we are doing something about them to prevent us from becoming diabetics. But God forbid, if you do develop some symptoms, and some of the symptoms that should prompt you to go to your doctor to get evaluated, not necessarily only for diabetes, but just to go on ahead and get evaluated, includes increased thirst, increased urinating, increased fatigue, blurry vision, weight loss, poor wound healing, numbness or tingling in the arms or feet. Those are all things that really we should be thinking about diabetes, or your doctor, if you go into the office and say these are the symptoms that you're having, your doctor is going to automatically start to think about diabetes and screen you for it or test you for it. um, but uncontrolled diabetes. So this is if you either don't know that you have diabetes, meaning you've been exhibiting these symptoms, and instead of getting evaluated, you kind of were just like, I don't have time for that. I'm working too much. Or meaning you just don't have the time in your busy life, because I do hear that one a lot. So if you just don't have the time, and it turns out that what was causing your symptoms all this time was in fact diabetes, then it can lead to blindness. So I think, most of us would, when you start to think about it, what would you do without your vision? Blindness, you could potentially end up having limbs compromised, which can lead to limb amputations. You can have kidney failure, heart disease, vessel disease. Those are all things that we do not want to happen. So, screening for these signs and symptoms, asking you about them. When you go to the doctor's office, generally they'll have a questionnaire for you to fill out. And the questionnaire usually includes a list of various symptoms. And they'll ask you, have you been having any of these symptoms in the past, maybe one week, 2 weeks, a month? And so they want you to list these symptoms, because that's our way of finding out if there are things that we should specifically be looking for. So screening for these signs and symptoms basically can get you into treatment earlier, if in fact you do have diabetes, or get you the earlier diagnosis, and kind of get you onto treatment faster. Having lifestyle modifications, so what we call disease modifying behaviors, meaning these are things that you can do that would change how the disease is progressing. Some I talked about already, which is the diet and exercise. So decreasing the carbohydrates or starches in your diet. So instead of having all the bread that's served on the table, maybe just having a piece or two. Instead of having the a large amount of rice or a large amount of potatoes, things like that. Just decreasing the amount of those things that you are having, that can help. So decreasing the carbs and the sugars. If you like sweets, and many of us have a sweet tooth, if you like sweets, you want to cut that down. So those are things, disease modifying behaviors that we can try to do to decrease our risk of developing prediabetes or progressing to diabetes. Or even if you are, like I said, already diabetic, that is one of the ways that you can, in fact, help, meaning you are taking medication. Modifying those behaviors will absolutely go a long way in terms of improving your A1C. Now, I didn't talk about A1C before, but the hemoglobin A1C is the test that we use to measure, to determine, one, do you have diabetes? If you already do have diabetes, we use it to measure how controlled, how well controlled your diabetes is. So we want to make sure, we want to prevent or delay the onset of diabetes or facilitate diabetes management by eating healthy, increasing our physical activity. So long-term weight loss. So for those of us who are overweight or obese, 5 to 7% of your body weight can actually help you to decrease the incidence of pre-diabetes and diabetes. You can do this. One of the ways you can accomplish this, because I like to tell people things that are going to be sustainable over time. At the end of the day, you don't want to, a lot of people will do these crash diets, or, oh, you just exercise intensely for a short period of time, and then you give up on it and rebound, and the rebound is worse. So, what you want to do, and what's the recommended amount of physical activity, at least 150 minutes of moderate intensity physical exercise per week. Now, when I talked about hypertension last month, I was talking about walking as your moderate intensity physical exercise. But you got to walk to the point where you're not able to carry out a conversation. If you're still able to be chatting it up with your friend while you're walking, you're not doing enough. You got to do it to the point where you're not able to carry out a full conversation. That likely means your heart rate is increased. Many of us have these smartwatches, Fitbits, all of these things. They will tell you if your heart rate is increased. So you want to increase your heart rate to know that you're doing enough work. So those are some of the things that we can do to really facilitate, or to help to prevent or delay the onset of pre-diabetes or diabetes. Now, if you are already diabetic and you're on a medication, the way that the medications are determined, to the way that we determine what we're going to give, one of the first line treatments that is usually prescribed is metformin. Metformin is like first. Everyone doesn't tolerate metformin, but it works amazingly well to decrease your A1C. So a lot of people will complain that, oh, why do I have to take this medicine? It's because we want to get diabetes under control so that it does not progress any further. Now, if you are taking metformin, oftentimes, if your diet and exercise habits have not changed, chances are you're going to end up on a secondary medication. Some people end up on more, or to the point where they are now on insulin. So, the way to think about this is really keeping things under control. If you are taking a medicine that does not work well for you, that needs to be a discussion with your primary care doctor, or with whichever doctor you have that is prescribing the medicine. Because generally, if a medication does not work for you, there are other options that you can use in order to treat diabetes, or to treat whatever condition it is you're treating, instead of just stopping it on your own and not telling your doctor. Please have those discussions with your doctor. It is absolutely important. Okay? So that's a lot of information, but generally, that's the things that we went through over this month. Now, do you all have, what questions do you all have? Send them in the chat. on Facebook, send it to me in a DM or in the comments below. I'm happy to answer whatever questions you guys have. If I cannot answer your question, because sometimes people will send me questions that are very, very, very specific to their condition. And in situations like that, I will tell you that sometimes I do have to refer you back to your doctor because I don't know the full picture. Oh, I don't always know the full picture of what's going on with you because I am not your doctor. I don't know your lab results. I don't know what everything looks like. And I want to ensure that you are getting all the appropriate information that you need. So there are things where you absolutely will need to speak to your doctor, but I will try to help you as best as I can. Okay. So let me go ahead and start checking for where we might have some of these questions. Okay. But once again, while I'm doing that, I want to thank you all so much for joining me this evening for this discussion about diabetes. So let me see, what questions do you all have? Okay. So while I wait for your questions to come in, I'm going to go ahead and mention that. So we talked about a little bit about A1C, right? And the A1C, like I mentioned before, is the test that we use to check for diabetes. Now, that is not the only test that's used, because generally, if you have, like, let's say that you go to your doctor's office and your doctor does lab work and there something is just off, they realize, okay, your blood sugar is elevated. They will then do subsequent testing, including the A1C, to check. But we can get a random plasma glucose. So that means we just get it at random. It doesn't mean you weren't fasting or anything. We can get that level, or we can get a fasting blood sugar level. The other one is we can do a glucose tolerance test. Most people don't like that because it's basically drinking oral glucose and then seeing how you respond to that. And that one takes a little bit of time in comparison to just having your blood drawn, in essence. So there's not only one way to test for diabetes. However, we use the A1C because the A1C gives us a picture of how you have been doing over the past 3 months, because the red blood cells turns over every 3 months. So that gives us a better indication of what's going on. And an A1C level of 6.5 or greater is what we consider concerning. So in essence, we want your A1C to be less than 6.5. Now, if you are a diabetic, that set point shifts a little bit. We want to make sure that you're below 7. Okay. And then if you have any, sorry. So I'm going to go ahead and start answering some questions as I see some are coming in. Again, if you have questions, just send me a message on Facebook in the comments, or on YouTube Live in the comments, or you can DM me on any of the platforms that Amize Health is on, which is Instagram, TikTok, or LinkedIn. So, would you be able to shed some light on diabetic ketoacidosis? So that is a very specific question. And the reason why it is specific is because, so diabetic ketoacidosis occurs in patients oftentimes when their blood sugar levels have been quite elevated. So usually it doesn't happen at a blood sugar level that is slightly elevated. So if your blood sugars is 150, usually you don't end up in diabetic ketoacidosis. And also, most patients who are type 2 diabetics, so they still have some pancreatic function, they tend to not end up, it's a different name for it. It's not diabetic ketoacidosis and per se, not to say that they can't have it, but it more commonly occurs in those with type 1 diabetes. And tonight we want to try to focus on type 2. um, but that's typically what how that happens. Usually people who are in diabetic ketoacidosis are very ill and need to be admitted to the hospital in order to get that under control, because it's a delicate balance, because as the name implies, diabetic ketoacidosis means you're going to have increase in ketones, increase in acids, and your blood sugar levels are very high. So in order to get that delicate balance back, usually that person needs to be hospitalized uh, in order to be treated with insulin and whatever else is necessary. There's generally a slew of things that needs to be done, um, that I won't go into, but they need to be evaluated in the hospital. So if there is a concern for diabetic ketoacidosis, generally people who have had it in the past or are familiar with someone who have had it can kind of say, okay, well, my sugars are 300s, 400s, 500s, sometimes off the charts, and they end up in ketoacidosis and they have to get seen. So generally, for those who still have pancreatic function and like type 2 diabetics, they end up in a hyperosmolar state, and they need to with those elevated sugars, they need to be hospitalized also to keep those sugars get those sugars back under control. So in either case, whether you're type 1 or type 2, you need if your sugars are that elevated, that is one of the things that we get very concerned about, that you might slip into ketoacidosis. So you need to be evaluated. And oftentimes, if you go to the urgent care, or if you're in your doctor's office and your sugar is sky high, what we'll typically do is, if we have the capability to do it a point of care lab, we'll do a point of care lab to check on your acid base status. And depending on what that shows, we might be sending you right off to the emergency room. Okay. Hope that answered that question. Let me check to see if there's any additional questions. Please keep them coming. Okay. So one of the things that I will mention, because it comes up, actually a few things that I need to mention that comes up quite often. When you are diabetic, you need to have your eyes checked annually. And this should be done by an ophthalmologist, or you need to go somewhere where they are checking your retina. You need to have your eyes checked at least once per year. That is a critical thing to do, because especially in uncontrolled diabetes, you can progress to what we call retinopathy, which is a type of disease of the eye that affects patients who are diabetic. So have your eyes checked at least once a year. Also, you need to have your feet checked every time you go to the doctor's office. Get your feet checked. I'm not talking about in the urgent care. I'm talking about with your primary care doctor or whoever is actively managing your diabetes. So you need to have your feet checked. The reason for that is, oftentimes, you know, when your sugars are elevated too much, over time, we get some neuropathy, which is you can either get numbness or tingling, or that kind of fiery sensation in the distal parts of your fingertips or your toes. And in essence, you get loss of sensation in those areas. And when you begin to get loss of sensation, sometimes people don't even realize they're losing sensation. So part of the foot check is that we're checking to ensure that we know whether or not you are losing sensation, because the tests are more sensitive to pick that up than you just on your own. So one, it's getting tested for that. Two is, part of losing sensation means, if you get cut, like, oh, you stubbed your toe on something, or something caused a laceration on one of your toes or something like that, you can get cut and not even be aware that it happened. And so getting your feet checked routinely means that someone is keeping an eye on your feet. Now, If your sugars are elevated a lot, so if you have uncontrolled diabetes, oftentimes what will happen is if you are not getting your feet checked, and you get that laceration on the toe and you don't realize it. Now, one of the things that can happen is delayed or poor wound healing. I mentioned that earlier. So, because your sugars are so high, your wounds are not healing as fast as they would have without diabetes. And so you need to be getting your feet checked every time you go into your primary care doctor's office. Now, if you are someone who have uncontrolled diabetes, oftentimes your doctor will want to see you maybe every 3 months. And or sometimes even every month, depending on how high your A1C is. Now, I know that's frustrating for some of you guys because I've had my own patients say, why I need to come in here? Y'all just trying to take my money. Now, it's not about taking your money, it's about making sure that you're healthy. And so what that is if your A1C is 16, I need to keep my eye on you. I need to make sure that we are doing whatever is necessary in order to begin to bring your blood sugar under control. Now, this does not mean, because all I can do is tell you or give you the information that you need, make suggestions to you about things that need to be changed, but it is ultimately up to you to make those changes. So I typically ask my patients to be honest with me about where they are in the process. Now, do you think you are capable of making this kind of dietary change, this kind of exercise change or physical inactivity change? Are you able to make those changes? Because if you're not, we need to be we need to be aggressive about these medicines. Now, if you are, that does change things a little bit. So I would like to know that whether or not you are taking your medicines. And sometimes I have patients will come in and they'll say, I'm taking my medicines, I'm doing what I'm supposed to do, and nothing, and I'm not. But your A1C would not continue to increase if you were doing what you were supposed to do. So I think starting off by being very honest about what's happening is critical. Okay. So get your eyes checked once a year. Get your feet checked every time you go to the doctor's office. If you're going in every 3 months, get it checked every 3 months. If you're going in once a month, get it checked once a month. But you need to do that. And if your feet are to the point, which some of y'all let your feet get to this point now, you're not washing them. So we got to be honest. If you let your feet get to the point where it's highly calloused, so the skin has thickened very much, they're not being cared for, that the nails are very thick, very long, you need to see a podiatrist. Okay? So you need to see a foot doctor and start getting that addressed. So, next question here. Hey, thank you for joining, and thank you for your question. Are there any specific symptoms or signs that you should watch for that might indicate diabetes is not well controlled? So, earlier I mentioned some symptoms that were signs that you might have diabetes, right? So those same signs and symptoms that I mentioned before actually would tell you that you're not controlled, because in essence, if diabetes is under control, those symptoms would resolve. So those symptoms include, like increased thirst, increased urination, fatigue, potentially having blurry vision. Sometimes you can get a little bit of weight loss when your sugars are really uncontrolled. You're having weight loss without even trying. The poor wound healing, getting numbness or tingling in your fingers or toes, all of those things can be because your sugars are very high. That it can absolutely be because your sugars are very high. So pay attention to those things. If those things are happening, absolutely it could be from uncontrolled diabetes. Now, one of the things that I want to bring up here is when it comes to diabetes can lead to kidney issues very oftentimes, just like high blood pressure can lead to kidney issues. So sometimes those kidney issues, you'll see it can be when you urinate, when your sugar is very high, when you urinate, your urine actually, the odor kind of changes. And if you, not everybody pays attention to this, but it'll tend to have like a sweeter smell, um which is not it's not normal. When your urine starts having that sweeter smell, it means that you're spilling sugar into your urine, and that means your blood sugar is very high. So that is one of the indications that that diabetes is not well controlled, that urinary change. Sometimes it'll be microscopic, so meaning our eyes cannot see it. Microscopic blood in the urine. With that one, part of the way that you can tell without visually seeing it, the color of the urine will begin to change. It may not be red because at that point it's not microscopic anymore. That's just gross blood. But it may be like orange tinged kind of, if that makes sense. So changes in your urine should alarm you, or should, excuse me, not alarm, alert you to the fact that you need to pay attention to your to diabetes, to your symptoms. Have you been taking your medications? And please, 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 people say this to me all the time. I only take my medicine when I feel like I need it. If you are prescribed medication for diabetes, one of the better things that you can do for yourself is actually take it, okay? And part of that is taking the medicines, because if you want to get off of them and you're taking them and you're doing what you're supposed to do appropriately, potentially, if you're losing weight and doing the things that you're supposed to do, potentially you could get off the medicines. But what will happen is, if you stop them on your own, if you stop those medicines on your own and don't tell your doctor, you don't do anything, you continue eating a lot of carbs, continue eating a lot of sugars, it's going to begin to affect many different organ systems. So, to some of the ones that we've already touched on tonight are your eyes. We've talked about kidneys. It can actually affect your heart. It can affect your blood vessels. So it can affect your neurological system, the numbness and tingling that I was talking about. It can lead to strokes. I mean, it really can impact every organ system on a different level. So take the medications, have the conversation with your doctor that you want to be off of them, and have them discuss with you a plan for how you can get off them. Now, not everyone can get off them. Let's be honest. Not everyone can get off them. I think being honest with yourself is very important here. But part of the reason why not everyone can get off them, because some people have uncontrolled diabetes for so long that after a while their pancreas has no longer has any reserve. So in most type 2 diabetics, especially when you're initially diagnosed, your pancreas still functions, it just doesn't function at the optimal level. But over time, if you continue with uncontrolled diabetes, sometimes after a while your pancreas is like, you know what, I'm tired, I can't do this no more, I tried. And when you get to that point, in essence, um basically kind of like how type 1 diabetics are not, their pancreas do not function, you as a type 2 diabetic can get to the point where your pancreas doesn't function by not taking your medications, by not doing what you're supposed to do. Is I have many patients who are on insulin, because you don't get to insulin if you become a type 2 diabetic, you're not automatically prescribed insulin, right? Usually we start with oral medicines first. So if you get to the point where you now need insulin, it means your pancreatic reserve is really, really decreased. You and some people will get to the point where they need insulin to survive, and you need that insulin. So when you need insulin, you cannot just say, I'm gonna take my medicine when I want to. People do it. I know people personally who do it. And it is only the grace of God, I think, that keeps them going. But that is not the best way to manage any illness, including diabetes. So I hope that answered your questions for the types of symptoms that you can have when diabetes is uncontrolled. They're very similar to when you're having the symptoms and you are not diagnosed yet. Okay. And so it looks like we have a couple additional questions. Let me just see here. Just a second. I'm having a. So it looks something like I'm making health changes and exercising, but sometimes I get really hungry and start sweating. That's okay. Could my blood sugar be too low? Yes. So sorry. I just wanted to get that question in properly. So um sometimes with a diabetic, you can absolutely have your blood sugar drop because you haven't taken in enough adequately dietary. So that's why the blood sugar might drop. So I would recommend making sure that you have a sufficient amount to eat, and also making sure you're drinking water and staying hydrated whenever you're working out, whenever you're exercising. And because a lot of what you just said, getting hungry and start to sweat, when you're sweating, if you think about it, you're losing water, right? You're sweating. And if you're sweating a lot, and sometimes some people will go to the gym or they go somewhere and they are not they don't eat anything, and they don't have breakfast, they don't, like, they'll get up in the morning and just go. So absolutely your blood sugar can drop. And then let me just throw this in there too, especially for a diabetic, because the way that it works is you have if you are taking long acting insulin, and that insulin is working. So let me go back to some physiology. So your pancreas produces insulin. The insulin is used to bring your blood sugar down lower. um, and generally, in a person that does not have prediabetes, does not have diabetes, your pancreas will produce enough insulin. The insulin does its job, it brings your blood sugar under control, and you're good, right? If you are diabetic, not on medicines, your pancreas, a type 2 diabetic, let's be clear about that. Type 2 diabetic. Um, if you are type 2 diabetic, not on insulin, not on any medication, your pancreas does not there's insulin resistance. And so what happens is your pancreas either doesn't produce enough insulin, or the insulin is not capable of bringing that blood sugar back under control, like in someone who doesn't have diabetes. And so what in essence happens is the medicines that are used to treat diabetes, they work in various different ways, and I won't go into all of that. However, in general, it's to help the function of the pancreas. So those who are on insulin, instead of your pancreas producing all the insulin that you need to bring your blood sugar under control, you are in essence injecting insulin into your body to bring that blood sugar back down low, right? So let's say that, now coming back to the question that you have, let's say that you have injected your insulin and the insulin is doing its job, right? Bringing that sugar down low. And now you chose not to eat. Or you started exercising, so your body is actually using up the food that you ate, but you still got that insulin on board. What's going to happen is it's going to bring your blood sugar lower. because your body is metabolizing the food you ate, and you're in essence you're doing what you're supposed to be doing, right? So you can see, if you can extrapolate from what I'm saying, people who exercise more, so no longer sedentary, you're doing the work, right? They likely would not need as much insulin. But if you are someone who don't exercise, and you're given a set amount of insulin, and all of a sudden you started exercising and you're making the dietary changes you haven't told your doctor, and you're still taking that same level of insulin, it's going to drop your blood sugar lower more often, and that might become an issue for you. So if you are someone that's having that problem, please, please, please have a discussion with your primary care doctor or whomever is prescribing you insulin, so that they know what you're doing and can adjust your medications appropriately. Okay? I hope that was a long a long answer, but I hope it answered what you were asking. Um so that's pretty much how that works. Let me just go on ahead and check to see what other questions we have here. Like, again, I said, I'm so happy to have all of you join me this evening as we talk about diabetes. This is something that really hits our communities at an alarming rate. Part of the reason for that, you know, we talked about it in the beginning about the the risk factors that many of us have: age, race, family history, but also some of the other things like having obesity, or being overweight, or having polycystic ovarian syndrome, having had gestational diabetes, in pregnancy. There are all these reasons why it could potentially be the case. Now, when I mentioned race, those of us who are of minority races, specifically Black, are at increased risk. And in many of the places where we live, our diets aren't the greatest, right? Eating fast foods, or um, basically not eating healthy foods, having a healthy diet or having a balanced diet, those things are just not helpful. So I would encourage those of us who have the ability to really start making better choices in terms of what we're putting inside of our bodies, because what we put in will affect the functioning of our bodies over time. So sometimes people will tell me, it's not a big deal, I can eat whatever I want to. And you can. I can't stop you. The other than that, the doctor next door sure enough can't stop you. You could eat whatever you want. However, when you continue to do those things, like the bad, not eating well, in essence, not eating a balanced diet, when you continue to do that over a period of time, it catches up with you. It really does. It really does. And then for those of you who come into my office, I feel for you. I do. But we got to make changes. This is why we're having these kind of conversations, so that we can start making the changes early, right? If I make a change now, and I'm living my life in a way that my children see the changes that I'm making, then hopefully what they're learning is how to do better, right? That's how that's what they're learning. But if I keep doing the wrong thing, or if I keep eating poorly, or if I keep living a sedentary lifestyle, then that's what I'm teaching my children too. And so this process continues. So let's try to break out of that and do something new. Let's try to do something to change generationally what's happening. Because if I change now, right, and my children makes this, sees the lifestyle of change, and they live that way, by the time grandkids and great grandkids come in their generations, they won't even be able to say, I have a family history of diabetes, right? So we got to think about that in terms of longevity in our lifestyles and how it impacts our families and those around us. That's why all of this is critical. I'm again thankful that you all joined me. I will check to see if you all have any additional questions before we close out for the night. And as usual, whenever I post a video each week, those will be the videos that I'll be discussing at the end of the month. So always the fourth month, 8 p.m., both on Facebook Live and on YouTube Live. I am grateful for you guys, and I hope that this is helpful, and I hope that you all can make some sustainable changes that is going to help not only you, but those around you. All right. So, no additional questions. You guys have a wonderful week. If you think of any questions after I sign off, be sure to send me a direct message on any of the social media platforms that you may follow me on, which is Instagram, Facebook, YouTube, and TikTok. So you can, and LinkedIn. You can always send me a message on one of those platforms. And should you want to book me for a speaking engagement, you can always direct message me on one of those platforms also. Happy to be talking to you about topics that are so important. You guys have a wonderful night. Thank you for joining me again.